It's my pleasure to kick off the keynote session by introducing you to Randall Holcombe. Dr. Holcombe is the director of the University of Vermont Cancer Center, associate dean for cancer programs at the Larner College of Medicine, and UVM Health Network director of integrated cancer programs. Dr. Holcombe is a practicing GI oncologist and has over 30 years of experience in translational research. He's served as a principal investigator for over 150 cancer clinical trials, and his current research activities are focused on healthcare delivery science to define and develop new approaches to improve the quality of cancer care delivery. We're so grateful for Dr. Holcombe's leadership, and we're thrilled that he can join us today to introduce our keynote speaker.
Thank you. No applause from me, please. I'm just doing intros, but very much appreciated. It's a pleasure to join you all today. Our mission at the UVM Cancer Center encompasses not only exceptional patient care, but also groundbreaking research to gain new understandings about cancer and new approaches to combat it. Educational programs to train the next generation of cancer scientists and clinicians. Clinical trials to bring tomorrow's treatments to today's patients. And community engagement to reduce the burden of cancer through prevention, screening, survivorship, and holistic patient and family-centered support. This conference is truly emblematic of our mission. Whether you are on the front lines of treating patients, a patient navigating through your own cancer journey, a researcher pushing the boundaries of discovery, or a trainee who aspires to be a future cancer doctor or scientist, I hope you find points of connection here today and have found them already through this morning's sessions. I'd like to take a moment to express my gratitude to everyone who made this event possible. Our dedicated planning committee, Molly Berry, Jamie Kelly, Farah Khan, and Kim Feeney, and all of our speakers and panelists. Let's give them a round of applause. Our community outreach and engagement staff, especially Rachel Sweinenberg, Kate Strautmeyer, along with Terry Karen and Laura Martin on the CME team, the Davis Center events crew, Cancer Center volunteers, and so many others who helped make this community event come to life. Let's give them a round of applause as well. And finally, this conference would not be possible without the philanthropic support from the Patty O'Brien, M.D. Women's Health and Cancer Fund. We are so appreciative of this sustaining gift and all of you who donate to support our event. Our keynote today will dive into the theme that is gaining critical attention, climate change and cancer. Climate change is reshaping the world we live in, and its ripple effects are being felt in all aspects of our lives, including healthcare. From the increased incidence of certain cancers to the ways in which large carbon footprint of the healthcare system impacts our environment, the connections between our planet's health and our own are becoming more apparent and much more urgent. With this in mind, it's my pleasure to introduce our keynote presenter, Dr. Christine Vatovec. Dr. Vatovec is an environmental health social scientist who studies interconnections between human and planetary health and serves as the planetary health lead at the University of Vermont Osher Center for Integrative Health. At UVM, Dr. Vatovec is a clinical assistant professor in the College of Nursing and Health Sciences, research assistant professor in the Larner College of Medicine, fellow in the Gund Institute for Environment, and lecturer in the Rubenstein School of Environment and Natural Resources. You have more titles than I do, so this is really, that is impressive. Dr. Vatovec's scholarship focuses on identifying opportunities to align healthcare with planetary health through interventions that improve outcomes for patients, providers, and the natural environment. Her first book, Dying Green, A Journey Through End-of-Life Medicine in Search of Sustainable Healthcare, was published in April of 2023 by Rutgers University Press. Thank you all for being here and being part of this conversation. Together, we can work toward a healthier future, both for people and for the planet. Dr. Vatovec, welcome, and thanks for joining us.
Thank you all for being here. Thank you so much to the Planning Committee for inviting me. It's an absolute pleasure for me to be up here. And having been here through the morning and participating in some of the sessions and just getting to hear all the different things that are being talked about and discussed here, I'm seeing that my role really is bringing lots of different pieces together. In some of the sessions this morning, talking about various integrative health therapies, thinking about food systems, also thinking about environmental pollutants. And when I stopped for a moment before lunch to just think about how am I fitting into this picture, I'm seeing that what I am providing is somewhat of an umbrella to bring all those different pieces together. So thank you so much for having me. I'm going to start off first with the classic, I have no disclosures, and then thinking about how do we fit this topic of climate change and cancer into a little bit bigger context. I'm a big picture thinker, so I always tend to go to how do we see where everything fits together. And how many of you have heard this term planetary health? We're hearing it more and more, just in general, and here at the University of Vermont, we now have a new planetary health initiative. And so, as the planetary health lead at UVM's Osher Center, I feel compelled to help us understand a little bit about how does climate change and cancer fit within planetary health. And really just wanted to take a moment to say, what is this new to us sort of idea of planetary health? And I want to just mention, it's not new at all. It's very much based in traditional ecological knowledge and indigenous wisdoms of the fact that the health of the planet very much determines the health of the people. And there's a bi-directional relationship there, where the ways that we go about trying to achieve health have an impact back on the planet. And we'll see that as we dive in a little bit further. The other thing I want you to know about planetary health is that there are 9 different Earth systems that environmental scientists study to determine the actual health of the planet. And climate change is one of those systems. So the planet has a climate system. And right now we're seeing unprecedented perturbances of that system. And that is then causing us to have ill health. So just knowing that this topic of climate change in particular is one piece of that bigger picture of the health of the planet. So this is an image that I've borrowed from the CDC. And what you see here is in the middle, this spiraling piece is telling us exactly what climate change is. And what we see is as CO2 levels, carbon dioxide levels, and other greenhouse gases, as those levels increase from burning of fossil fuels, for example, that leads to rising global temperature, which ends up changing things like the weather patterns. We're seeing more extreme weather. We've experienced that here in Vermont over the past few years in particular. We also see things like sea level rise, and then all those different pieces feed back into each other in this positive feedback loop that continues to increase the rate at which we're seeing the climate change. The next layer out is looking at the different pieces of the environment that then change. So as the climate changes, we actually see increased levels of air pollution, changes in vector ecology. That means things like ticks and mosquitoes. People in Vermont right now are very aware of EEE, Eastern equine encephalitis, being something that is spread by mosquitoes, and Lyme disease, of course, from ticks. We also see increasing allergens. When you have a longer growing season for plants, you will see longer seasons of allergies. We see water quality impacts, and we note that with cyanobacteria in Lake Champlain. We see water and food supply impacts. Again, something that we experienced here right in Burlington in the Intervale Center when we've had extreme flooding. The floodwater impacts the ability of our farms to be able to grow food. We see environmental degradation writ large, extreme heat, so more and more heat events. In Vermont, when we hit 87 degrees Fahrenheit, that's when we see the number of emergency room visits increase. So 87 is our threshold for extreme heat in Vermont. And then, of course, severe weather. And of course, we've experienced some of that severe weather over the past few years in particular. So you take that circle, and then we move out to this broader area that's the outside of this image, and that's where you see the actual health effects of climate change. So moving from that inside, what is climate change, all the way out through how does it affect the environment, and then how does it affect our health. And that's what we're here to think about. What is the role that cancer plays in this particular piece of climate change? Drilling in a little bit closer, this is information that comes from our Department of Health Climate and Health program. We've got some really great folks working in climate and health in our Department of Health, and they've come up with these graphics for us to understand what's happening in Vermont. And basically what we see is what you've all experienced. We have hotter summers, shorter winters, and more frequent storms. And we're going to continue to see that. The trend is on an upward level. So we're going to be warmer in the coming 50, 100 years. We're going to continue to see more frequent heavy precipitation events like the flooding that we've seen over the past few summers. What does that mean for us? So we looked at the CDC diagram, and now we're thinking about, well, what among those different health impacts that the CDC is reporting on are we really seeing here in Vermont? And again, this is information that has been compiled by our climate and health program at the Department of Health. And again, these are things that you may have experienced yourself. You're just noticing the heat. You're noticing more extreme weather. These vector-borne diseases, EEE, Lyme disease, air quality. We saw this particularly last summer and somewhat this summer as well with the haze from wildfire smoke in different parts of Canada and or the western United States with that smoke just blowing on the wind and coming across to us, and that's affecting our air quality. We're seeing the potential for foodborne and waterborne pathogens, so different species that will, bacteria, viruses, things like that, that can affect our food system. So for example, when you have the intervale or other farms that are flooded, that food can't be deemed safe. So even if there is some amount of food that can be harvested after the floodwaters recede, it's not considered safe because it could have been contaminated by pathogens from, such things as wastewater that has overflowed or manure that has flowed down the pipe into the land. And then, of course, cyanobacteria, the blue-green algae that we're seeing in Lake Champlain. So these are the things that you are most aware of in thinking about how is climate change affecting our health here in Vermont. And just to make this piece a little bit more clear, we're not the only ones experiencing these things, right? And it's becoming more and more apparent that even though we have in the past thought of these health effects of climate change as something that we might expect to see sometime, we're living these things now. And we're experiencing these, and we need to be thoughtful about how to respond as individuals and as communities. And what can we do to prevent harm in the future? So we have great folks working at the American Cancer Society. We also have at the National Cancer Institute some folks who are working specifically on climate change and cancer. So if you're interested in this particular topic, there's a lot of great resources out there that are already available for us to start thinking about, and for Vermonters to be more prepared and more aware of what can we do to help limit any potential for harm that we might face. So I alluded to this idea before when I described planetary health. Here what I want to talk about is that this connection between climate change and cancer care, it's really bi-directional. The changing climate does have an impact on cancer and cancer care, but the way that we respond to cancer through cancer treatments also has an effect on climate. So how can we be mindful about the ways that we are approaching this connection? What can we do to inform ourselves so that we do have better outcomes for patients and the planet? So the most obvious thing that we will see, and coming through the scientific literature, is just this idea that when you have some sort of large storm, you will see disruptions to the healthcare system. Think of flooding, for example. If you are living in an area where there's floodwater that prevents you from getting to your healthcare clinic for treatment, that's going to disrupt your care in some way. And so, again, folks are thinking about this on the national level. What are the things that we can do to minimize potential harm? So continuing to think about this way that climate change affects cancer care, a couple of things come to mind. One is the idea that we know that there are many lifestyle factors that help people stay healthy and reduce our risk of cancer. And we'll talk more about these in a few minutes, but really thinking about things like making sure that everyone has access to culturally appropriate fruits and vegetables and knows what to do to prepare those foods. And thinking about making sure that people can stay physically active, because we know that diet, physical activity are two things that help reduce our risk of cancer. So when you have something like flooding or droughts in other parts of the country that disrupt the food supply in some way, then you have a potential to be impacting those preventive care aspects of the food chain, making sure that everybody has access. What do you do when your local farm has been flooded out? How do you make sure that people still have access to healthy fruits and vegetables, for example? And then when you're experiencing something like wildfire smoke or heat waves where it's just not as comfortable to go outside and be active and getting that physical activity in that we know helps reduce our cancer risk, what can we do to make sure that people are still able to stay active? So this is one of those pieces where climate change is having an effect on health promotion. Another piece is the potential for increases in exposure to carcinogens in the environment. And we had a wonderful presentation earlier today from someone who's an expert in this area of environmental carcinogens. And a couple of things here that I will just bring back to light, especially for folks who were in that talk, are thinking about some of the things that have very recently been studied and published in the academic literature, where we're thinking about when you have, for example, a flood, what is that flood water picking up that is then carried along and could create an exposure for someone in the future, whether it be where that floodwater flows onto farm fields, for example, or people who are going in while their floodwater is still there and trying to help people clean up. What can we do to minimize potential exposures to floodwaters in particular? And we'll see here, there was a study recently published in 2022 that was looking at these polycyclic aromatic hydrocarbons. This is a PAH. It's a known carcinogen. It happens to just be a natural byproduct of burning fuels. And in some places in Louisiana where there's a lot of petroleum processing, after some hurricane floods, they were able to see that there was an increased exposure to these chemicals in the floodwater. So just making sure that we're aware. In Vermont, we don't have these same types of petrochemical processing plants, so this would be a different type of exposure. But nationally, these are things that we're thinking about. What is the potential for exposure to potential carcinogens from receding floodwaters, for example? Another piece here is outdoor air pollution and wildfire smoke in particular. We know that globally, air pollution is the #1 cause of lung cancer, so along with smoking, of course. But in terms of environmental exposures, wildfire smoke does contribute to lung cancer because it contains particulate matter that's size 2.5 microns or smaller. So this is very small little pieces of the black carbon you might see. The way to think about what is this PM 2.5, what is this black carbon? If you've ever walked down the road and you see a diesel truck going by or a bus and it has that big burst of the smoke that comes out the tailpipe, that's a very visible form of these pollutants that include the PM, particulate matter 2.5. So when you have these things in your environment, through increased occurrence of wildfire smoke, and then you are breathing those things in, there's a potential for that to exacerbate any sort of current lung cancer that's happening for people, but also has the potential to, be something that just increases exposure to our carcinogen simply by inhaling that smoke. So there's different ways that we're thinking again about as climate change continues to occur, we're seeing more likelihood of wildfires happening, which leads to more inhalation of wildfire smoke, more exposure to potential carcinogens. So what can we do to minimize that effect? What can we do to either help minimize wildfires from happening and at the same time minimizing exposure through masking, keeping people who are more vulnerable indoors, this sort of thing. The other piece that we alluded to before is just this idea of when you have some sort of, particularly a big weather event, like a hurricane or flooding, for example, that can disrupt cancer care. So if someone is actively in therapy, but they are unable to get to the clinic, for example, or to the hospital for their radiotherapy or their chemotherapy, how does that disruption affect someone's ability to heal and to overcome that cancer diagnosis? So you'll see these treatment delays, and there have been very recently, 2023, a few studies published specifically looking at this in Puerto Rico that had a number of people who had gone through cancer treatment during hurricane seasons, and that those folks did have more mortality because they were unable to achieve their cancer therapy at the time that it had been deemed that they should be in treatment. So something for us to be thinking about. How do we make sure that people continue to have access to care? And this I thought was interesting. So some places around the country are preparing their current folks who are undergoing cancer treatment to be prepared for weather events. So this is coming to us from the Moffitt Cancer Center, which is in Florida. So they, of course, experience more direct hurricanes, but they have these tips for cancer patients in making a plan, knowing what your medications are, knowing what your medical information is, keeping sanitation supplies on hand, because if you are undergoing certain types of treatment, of course, your immune system has been suppressed in some way, and so you're more susceptible to any sort of exposure to a pathogen, so being able to keep things sanitary can be very important. There are, in these areas in Florida, there are these special needs shelters that are available for people who are undergoing cancer treatment and other types of special treatment to make sure that they have the things that they will need access to. For example, in other ways, if you need oxygen, making sure that you are in a shelter that can provide oxygen to you, this sort of idea. And then contacting your provider ahead of time, making sure that you have all your medications on hand and can take them with you in your go bag, for example. So there are things that people, again, nationally are thinking about. How do we prepare folks who are undergoing cancer treatment to have the best possible outcomes given the climate world that we are living in right now? I'm going to shift focus now and think of that other direction, right? Again, we're thinking about how we really have this bi-directional relationship with both how is climate change affecting cancer, but also how does our healthcare system and cancer care affecting the climate, and what can we do there that will help mitigate some of these problems? So the first thing I want to point out, and this is the area of research that I work in, really thinking about the healthcare system as a whole has a pretty large carbon footprint. So that basically just means that we, as a healthcare system, globally account for about 5% of all greenhouse gas emissions, which is quite stunning. That's a quite large amount of carbon coming out of one system. The US healthcare system, we're even larger simply because of the way that we structure what healthcare looks like in our country, but 8.5% of our national greenhouse gas emissions come from healthcare. And some people ranked all of these things in different ways to help us see, well, what does that mean? And if the US healthcare system itself were a country, it would be the 13th largest contributor of all countries to greenhouse gas emissions. So we have a pretty big carbon footprint in our healthcare system. The majority of these emissions are coming from supply chains, and we'll learn a little bit more about that in a second. And I want to just point out, because another area that I really work on is pharmaceuticals, and pharmaceuticals themselves account for 10% of greenhouse gas emissions in the medical supply chain aspect of carbon. So in this diagram, we're drilling in a little bit further to understand where do those carbon emissions come from. And what we see here is that at the very bottom, that darker blue band, 7% of all carbon emissions in the US healthcare system are coming from direct emissions. So this would be something like a boiler in a hospital that is burning some sort of fuel. That fuel is what accounts for scope 1. Scope 2, this accounts for 11% of emissions. This is the energy that is purchased by a facility, for example. So if you are purchasing electricity from some other source to turn on the lights, turn on the air conditioning, that's what scope 2 accounts for. And then scope 3, which you see is the big one, 82%. These are all other supply chain emissions. So it includes anything along the lines of transportation and construction of the facilities, and plastics and rubber, medical supplies, and that's where this pharmaceutical piece comes in as well. So my interest is really in thinking about, okay, in scope 1 and scope 2, we have a pretty good handle on what we can do to minimize the carbon footprint of these things. We know that we can update aging boilers. We can make those things more efficient. We can turn towards alternative forms of energy, solar, hydropower, wind power, in order to help us decrease that scope 2 emission. What can we do in scope 3? And so this is the area that I focus a lot of my time and work on, and just thinking about what can we do to reduce the emissions from medical supply chains in particular, and pharmaceuticals. And as we go, you'll see the thing that I really think about is some folks are doing really great work on how to just make those products better, how to make those medical supplies have a lower carbon footprint just within themselves. I look at what can we do as a social system to understand the factors that are making us use more supplies than are needed. Because what we see is that we have a lot of waste of medical supplies, a lot of waste of pharmaceuticals in our system. And if we can get at the root of those problems, we can have a really big impact on decreasing this 82% in scope 3. To help us understand where those carbon emissions from a medical supply chain comes from, I'm just going to walk us through one example. So here we see an image of an IV bag, an intravenous fluid bag. The bag itself is made of some form of plastic. It's containing some sort of a pharmaceutical. It's hanging on some sort of a metal pole. It's being delivered to a patient through some sort of IV tubing. All of that material came from somewhere in the environment. It was harvested from a natural resource in some way. It was processed, it was transported, it was packaged, it was processed again in some way, it was transported again in some way, and finally, it makes it to the healthcare system. It sits on the shelf for a little while before someone goes into the supply closet and pulls it out. And then it's used very briefly, depending on what the item is, right? An IV bag itself, maybe depending on what it's delivering to a patient, it might be changed, every 4 hours, maybe every 8 hours, depending on what it is. The IV pole itself, much longer lasting, right? Hopefully you have IV poles that are lasting for years. The pharmaceutical very quickly is being used and processed and then excreted from our bodies, entering into surface waters, which is something else we can talk about as well. And then after that brief period of use, we dispose of these things. And depending on what it is, we might either put it in a landfill, where slowly it breaks down over time, releasing carbon, or we incinerate it if it has the potential for that item to be causing an exposure to someone that would be an infectious exposure. So we might incinerate it instead to limit that exposure to an infectious agent. And therefore, as we're burning it, we'll also be releasing some sort of carbon. So this is where that supply chain carbon comes from, just that whole process from the harvesting all the way through to the disposal. And again, what I'm interested in is looking at that point of care. What are we doing in the point of care that could change, that would help us minimize the waste of that system and the number of supplies that we are using? So I'm going to tell you a little bit about a study that I did where I was in 3 different units, inpatient units for cancer patients. This was a hospice acute care unit, a palliative care inpatient unit, and a conventional oncology and hematology unit. And what you see here with this arrow is just the overall trend was that there's an increase in the materials being used, the medical supplies, the pharmaceuticals being used across those 3 different sites. What you see here is basic ratios. And I apologize, I have them opposite of what the arrow is showing. So if you look here on your far right, hospice is listed as a 1. Everything else is in ratio to that. So for example, the top bar of medical supplies, for every 1 pair of hospital gloves that is used in hospice, 10 were being used in palliative care, 34 would be used in the conventional unit. For every 1 pound of waste in hospice, 2 pounds in conventional and palliative care. For every 1 dose of pharmaceutical being used in hospice, less was being used in palliative care, 1.3 would be used in the conventional system. So each of those are this ratio again, and it's in terms of per patient per day. So again, 1 pair of gloves per patient per day compared to 34 pairs of gloves per patient per day. When you look at that bottom line, which is the target length of stay, that's how long a patient is in any of these settings. So again, you see that there's going to be just a higher cumulative impact in the conventional unit simply because patients stay in that type of care setting for longer. So not only is there more being generated, there's also just a longer amount of time that you're staying there. Now, the thing that I want to point out here was that when I was doing this study, it took me about 2 years, and I was following doctors and nurses and social workers and purchasing agents who buy all of the gowns and the gloves. I was trying to understand what are those social factors that are governing when we have these unintended environmental impacts. And one of the most interesting stories I can share is that thinking about, I keep talking about the gloves really stood out to me because, for example, in the conventional unit, the nurses had been trained, and rightfully so, to protect themselves from any sort of pathogen. And that's what we want. That's what the gloves are for. They're there to help make sure that we aren't passing any sort of infectious agent between patients and that we aren't giving the nursing staff or other clinicians exposure to an infectious agent. We want the gloves. We really need those gloves. They help us. And the nursing staff in the conventional unit had been trained that as soon as they were called into a room, just outside of the room, they would grab a pair of gloves, put the gloves on, enter the room, find out what was needed, and the majority of time, what was needed did not require gloves. There was no contact with any sort of infectious agent. So the nurse would promptly take the gloves off and throw them in the trash, never having used them. This is why there's this 34-to-1 ratio, because in comparison, in the hospice unit, the nurses were trained to go first into the room, assess what was needed, and then, if it was warranted to put a pair of gloves on, put the gloves on. So this is just an example of helping us understand that there are these social factors, the training, the culture around how we're using supplies that has a big impact on how much carbon is resulting from those supply chains. This is a quote from a conventional physician, an oncologist, who also happened to have been trained in palliative care and did come over to the hospice unit often, following his patients along with him. And so he had insight across the entire system and just helped me understand, like, from your perspective as a physician, what's the difference here? Why are we seeing so much more being used in this conventional setting? And he helped me understand it through this quote. We just use a lot more testing. There's a lot more happening here. I point this out because one of the reasons why there was a palliative care unit at all was an internal study at this healthcare system, and this was in the Midwest. In the conventional oncology unit, they had done an internal study to try to understand who is the patient population who is coming into us. And what they found was that 70% of the people who were admitted, from the moment of their first admission, they would die within 6 months. They were eligible for hospice care from the very first time that they stepped foot into the oncology unit. And there weren't good processes for helping have difficult conversations with patients to help them understand what their actual prognosis was. And again, I note, especially for the folks who are clinicians in this room, prognosis is one of the hardest things. I am glad that this is not a part of my job because it's so difficult to make an accurate prognosis for someone. And at the same time, if we can learn from what these clinicians helped me understand, that with training for conventional oncologists in particular in this setting, if you have the training and you feel comfortable and confident in having those difficult discussions with patients, what you end up finding is that you are able to match what the patient's quality of life goal is better than if you continue pressing forward with treatments that do not improve the outcome for that patient. So in this situation, really what we're thinking about is how can we help encourage those difficult conversations so that patients have the full awareness of what their current prognosis is, what their full options are, and again here, pretty much everyone entering that unit could have the option of hospice, but they weren't being told that that was an option. Now, the other things that I learned about this were that in following folks around through these three systems for a couple of years, what I found and looking through the literature discovered more and more, by being open about hospice, folks who go into hospice can actually live longer than if they continued on a curative pathway when the cure just is not working anymore. People can live longer. You also find that quality of life can be better. People have a better option about what do you want for your care. Do you want to have this trade-off between kind of pain and lucidity? Some people will choose, I'd rather have a lower dose of pain medication if it allows me to be fully present with my family members and loved ones so I can speak to them. Other people will say, no, I'd rather not have the pain and be a little bit more sleepy. And that's the thing here, is that we want to make sure that patients have the option, and they weren't having that option because the conversations weren't happening. So if we can allow for the humanity of the situation to come forward and have those difficult conversations and let the patients choose what they think is best for them, we will end up with the better options, better outcomes for the patients in terms of their quality of life choices, their preferences, and also having a better outcome for the planet. Because if you transition a patient into hospice care when medically appropriate, as they would choose, then you will end up having this decrease in the amount of materials that are being used and the carbon that comes from that. So trying to build those two things together, right? Putting the patient first, because that's what the healthcare system is for, and recognizing that by giving patients full awareness and choice, you have the potential to also have this co-benefit of helping minimize carbon. That should be secondary when you're talking to a patient, and it's something that is actually a good benefit that happens through that process. So really what I'm here to talk about is this. There's a critical need for us to identify these better approaches. And in that case, right, it's how do we train our clinicians to feel comfortable and confident in having these difficult conversations, because it has better outcomes for patients, for planet, and for the providers themselves, right? It's a very hard thing to be fearful of speaking with your patient clearly. But if you feel comfortable and confident in having those conversations, you will feel less stress at work. You will be less burned out yourself. So it's a triple win, really. So what are the things that we can do to help us identify better paths forward? Here I'm pointing to Ellen Langevin, who is the director of the National Center for Complementary and Integrative Health, which is an organization within NIH. And I'm really drawn towards what she is saying about this idea of a whole person's perspective, which you're hearing about throughout the conference today, right? This whole person approach. Whether or not people have been speaking about it, that's what this integrative approach is all about. Allowing for the health of the person fully, mind, body, and spirit, to all be recognized. When you're in the healthcare system, the training for many decades has been looking at breaking down something to the organ system. What is the symptom that is happening? Here we're pulling back out and say, how is the person, mind, body, and spirit? And then here, Dr. Langevin is also bringing in this connection to the natural world. So I point back to this as a place for us to think about what's our pathway forward. When we're specifically thinking about that decarbonizing, minimizing the amount of carbon footprint that the healthcare system has, I see integrative health and this whole person approach as being a really promising pathway that can help us get us there. In terms of cancer prevention, we know that this whole person approach, these integrative lifestyle tools, nutrition, physical activity, stress management, and helping people stop smoking, those things alone have a really great benefit of helping us reduce cancer risk, improving the outcomes for people, and then also decreasing healthcare utilization. By keeping people healthy, you simply keep them out of the healthcare system. That's going to decrease the footprint of the healthcare system. Better outcomes for patients, providers, and planet. Here I'm giving you a specific program that's happening. This is the Vermont Department of Health 3450 campaign. They're saying there are these 3 behaviors. I'm sorry if this is very small for people in the back. 3 behaviors that cause the 4 diseases that lead to more than 50% of deaths in Vermont and across the United States. Those 3 behaviors, again, no physical activity, poor diet, and tobacco use. And on the top of the list here of those 4 diseases, cancer. So what do we know about what's happening in Vermont? 47% of adult Vermonters do not meet recommended physical activity. 20% of adult Vermonters say they are sedentary. They aren't getting anywhere near the amount of physical activity. In terms of poor diet, 61% of adult Vermonters not getting recommended fruit intake per day. 70% of adult Vermonters not getting recommended vegetables per day. 16% of adult smokers. So if we can work with our integrative health whole person approach in primary care to help make sure that people have access to fresh fruits and vegetables, make sure they know what to do to prepare those foods, make sure that people have access to safe, pleasant places to go for a walk, particularly in the winter, knowing that we are a rural and elderly population, we're an aging population. How do we make sure that people have a safe place to walk all year, but in the winter in particular when it's icy out and you don't want to fall? What can we do to work with our communities to provide access to that? How do we help people quit smoking who are ready? Those things will have a huge impact on decreasing cancer along with these other diseases, thereby, again, keeping people out of the healthcare system, keeping people healthy longer, decreasing that carbon footprint of healthcare. And then when someone is ill, when someone does have a diagnosis, and in particular here, of course, thinking about cancer, what can we use from this whole person approach with integrative health therapies that are evidence-based that can help, again, keep people out of the hospital, keep people feeling well, keep people high quality of life, and these things have a lower carbon footprint, if a carbon footprint at all. So I took a few minutes and just went and searched through the literature for randomized control trials, which is the gold standard for when you're looking at evidence-based in medical literature, or systematic reviews to understand what is the preponderance of evidence that these different things work. And I'm gonna flash through these quickly, but I'm happy to share more afterward individually with people. But we see that yoga has a huge positive effect on people who are experiencing cancer, helping decrease depression and anxiety. We know that the main line of treatment for cancer, or for depression and anxiety in general, are pharmaceuticals. We know that those pharmaceuticals have a large carbon footprint, and we know that those pharmaceuticals are in Lake Champlain. I have done studies looking at what are the pharmaceuticals that are in Lake Champlain. We know these things are in Lake Champlain and in surface waters around the country. So if we could prescribe yoga, either alongside a pharmaceutical to reduce the amount that's being used, or without the pharmaceutical, depending on the specific needs of that patient, we can improve the person's well-being while not having that carbon footprint. Similarly, there are other types of mind-body interventions that can be used to help reduce fear of recurrence. Again, anxiety related. Dietary supplements that have evidence base for being beneficial in cancer treatment. Dietary supplements for fatigue among breast cancer patients. Clinical evidence for manual therapies, things that you might encounter in physical therapy, for example, with cancer pain. Things about acupuncture, where acupuncture is just as useful either in conjunction with or in addition to or just simply as its own thing in terms of helping minimize some of those symptoms that people experience. So there's lots of different options that are available. If we integrate, right, that's what integrative health is all about. If we integrate these evidence-based therapies into the standard processes of care, we have this potential for both supporting patients, their well-being, while also decreasing that environmental footprint of care. Again, better outcomes for everybody. A couple other things to think about looking at a higher system level. What can we do across healthcare in general to help decarbonize, decrease that carbon footprint? I show here this journal that's the Lancet Planetary Health. So the Lancet is one of the most respected medical journals in the world, and they have a specific journal, Planetary Health, that they have had for at least 10 years now. And anyone in the room who is interested in diving in, this is a great place for understanding more of that evidence base. What do we know about different approaches for decreasing the carbon footprint of healthcare? But a few things. One is because the current medical system doesn't really always integrate all of those evidence-based approaches, at least in the US, how do we get our medical professionals to understand that they can use those therapies? We have to get it into the training. We also have to make sure the insurance covers those therapies so that people truly have access when it's prescribed to them. And we recently did a study, we're working on the publication right now. We surveyed adult Vermonters last spring to ask them about integrative health. And 70.5% of adult Vermonters in our survey responded that they would prefer an integrative therapy over a pharmaceutical if they knew that it would work just as well. So Vermonters want this. We just have to make sure that it's available to them. 38.8% of those same people said that their health insurance doesn't cover integrative therapies at all. So again, how do we make sure we're improving access? So to conclude, just that friendly reminder, these things are very connected. Healthcare, cancer care, planetary health, they're very connected. Climate change is impacting our health. It has implications for cancer treatment, thinking about making sure people can still get to their treatment, and also making sure that we are doing everything we can to prevent cancer from happening, decreasing those risks for people by making sure everyone has equitable access to fresh fruits and vegetables, physical activity, all those things we've talked about. And I really am excited about this area because I really think that we have this unique opportunity to completely transform the healthcare system by thinking about these things and integrating these new approaches in this mindful way that takes account of this full picture of how our individual health relates all the way back up to the health of the planet. So we have some work to do here, and we have so many people in this audience who are working on these things, and this entire conference is this amazing place where people are talking about all these different therapies that are available to us and things that we can do to improve our own well-being, improve the well-being of our community. And I'm really excited to be able to work on this with you all. And with that, I will say thank you very much for your time. My slides will be available afterwards through the website. And please feel free to contact me. I believe we don't have time for Q&A, but I'm happy to stick around afterwards, happy to answer any questions, and thank you so much for your time.
Thank you so much, Dr. Vatovec. That was fascinating and I think gives us a lot of areas that we should be thinking about as clinicians. And we definitely want to, I think hear from our patients and hear from their perspective about what they would hope we could offer, what they're looking for, so that we can all work together to try and make these things happen and create a more planetary friendly and satisfying experience for our patients. Our next session begins at 2 p.m. We have an amazing afternoon lined up. The exhibit hall closes at 3 o'clock, so please use this time to visit the amazing resources here today before our next session begins at 2. On the back of your name tag, again, you'll find a list of the lectures you selected at registration along with the room location as a quick reference. If you registered for support for the supporters, you'll be in the Sugar Maple Ballroom on the opposite side of the wall, going out through the Fireplace Lounge. If you signed up for the psilocybin-assisted therapy in the context of cancer, please return here. In-person registrants for the Integrative Health Coaching session should proceed to the Joss Foundation room down the hallway. You'll find coffee, tea, and an afternoon snack sponsored by the Eleanor B. Daniels Fund and the Fireplace Lounge. Please consider joining donors like the Daniels family in support of our UVM Cancer Center. There's a postcard on every table, and it only takes a minute. Before you go, we kindly ask for your assistance in keeping the tables tidy. Please take a moment to clean up your tables, including disposable products, and we'll see you at 2 p.m. Thank you.